the presentation today. I'd like to thank you all for coming to hear about vaccines and vaccination programs in the shelter environment. I'd also like to apologize for my case of kennel cough that I've developed as a result of traveling through airports and flying in airplanes. So it's not just our furry friends that get kennel cough, so too do you folk get it. And instead of talking about canine and feline infectious respiratory disease complex, you can talk about human infectious respiratory disease complex. So what I'd like to start with is just some general recommendations with regard to vaccination in the sheltering environment. And it's a little bit different than what it is for pet animal vaccination programs. And so one of the things we want to do is practice population medicine. And in relationship to pet animal medicine, we're usually looking strictly at the individual animal, whereas in the shelter environment, we're more concerned about the population of animals than we are about the individuals. So that's a real difference. And so my recommendations for vaccination in shelters would be then different. We should consider all animals to be unvaccinated, no exceptions, unless you are performing antibody testing or you have medical records. Otherwise, we need to consider all of the animals coming into a shelter as unvaccinated. And what we have found by doing surveys in a number of shelters around the country is that a very large percentage of dogs and cats do come in susceptible to the major diseases we'll be talking about. Up to 50% of dogs may never have seen distemper before coming into that shelter. And so that makes this population a high-risk population. Also, we want to vaccinate as early as possible. And that means prior to entry, that would be ideal, but often not possible, but certainly immediately upon entry. And many of you may ask yourself, well, why is it so important to get it early? Well, one of the things that vaccines do is they induce a nonspecific immunity right within minutes after you give that vaccine. And that's where there is really some advantage to vaccinating early and not waiting a couple of days for the animal to be in the shelter and to be exposed and not have the benefit of that so-called nonspecific or innate immunity. So animals enter the shelter either already being immune, if they've been vaccinated before, or if they've been naturally immunized. And when I talk about natural immunization, what that is that they've been infected with that particular agent and they've developed immunity to it. They may or may not have developed disease. Many of them will have, depending on what the agent was. They may enter being infected to possibly develop disease within a short period of time after coming in, or they're naive. That means they're antibody negative and susceptible, and they will get infected within minutes or hours after arriving and likely develop disease. Recognize that certain diseases in the shelter environment are not vaccine preventable. For example, I could have taken all of the vaccines available for humans and I would still have developed kennel cough. So too can the dogs get every vaccine that's available for that particular disease, or the cats, every vaccine that's available for preventing feline infectious respiratory disease complex, and they may still get it. And we'll talk a little bit more about that later. But unlike distemper, parvo, and adeno, which we'll talk about, or panleukopenia, those are vaccine preventable diseases, unlike the infectious respiratory disease complex. Certain animals are unable to develop adequate immunity with the effective vaccines. And this is a very small percentage. For example, for canine parvovirus, there's about 1 out of 1,000, and this is a genetic trait. They can't really develop a response to parvo. But you can see it's a very small percentage that can't. They may also, though, be impaired by the fact that they will have some nutritional deficiencies. They may be heavily parasitized or something, and that can reduce the likelihood that they will develop a strong response to certain antigens. But fortunately, the vaccines for the core diseases, the ones that we really want to prevent disease against, they are very effective in immunizing. So that's not too much of a problem with regard to animals unable to develop immunity. We also, though, have to deal with young puppies and kittens, and that's the greatest risk. Those animals at an age when they have maternal antibody, which can interfere with active immunization, but it can't prevent infection. So that's a group of animals, those young animals, that are going to be at risk and very high risk in a shelter environment. And my recommendation for vaccines and vaccination programs, as I've already mentioned, in the shelter environment differ considerably than for pet animals. And it's because, of course, of the greater risk of those animals developing many more diseases than would the average pet animal be at risk of developing, and in such a short period of time. So what are the so-called core vaccines that every animal, in this case every dog that's coming into a shelter, should receive? Canine parvovirus, canine distemper virus, canine adenovirus, canine parainfluenza virus, Bordetella bronchoseptica, and rabies virus for long-term stay animals. If they're only going to be in that environment for a short period of time, probably rabies is not necessary, although one of the things that I would like to see with regard to dogs, especially when they're adopted, is often they don't get to see a veterinarian after adoption, and sometimes they really don't get a follow-up rabies vaccine after they come out of the shelter. So from a public health standpoint, those shelters that can do and provide a rabies vaccination, it would be a real advantage, because then you know that that animal is going to have protection against rabies for a period of time after it leaves the shelter, and then hopefully it will be eventually vaccinated with rabies. But the parvo, the distemper, the adenovirus, the paraflu, and the Bordetella, we would definitely like those animals vaccinated as early as possible on entry to the shelter. How about feline vaccines? Well, Feline Panleukopenia or parvovirus vaccine, calicivirus, herpes virus, rabies, again, the long-term stay animals, and for kittens, if in fact the shelter is testing for FELV and FIV, and if that animal is not positive for FELV, then another vaccine that should be considered would be, especially for kittens, the feline leukemia vaccine. And that does require 2 doses be given 2 to 6 weeks apart. And this would provide a tremendous advantage to that particular kitten, both in that shelter environment as well as once it gets out of that environment, to not really develop persistent viremia as a result of being infected with FELV. So that's the core feline vaccines. And if you have any questions as we go along, you can ask those. Important questions that I would ask is, what are the most important canine and feline diseases in the shelter? Which canine and feline diseases can be prevented by vaccination? How many days will it take for the vaccine to really provide protection? Well, the two most important canine vaccines or diseases and vaccines that we need to be giving are canine distemper and canine parvovirus. So approximately what percentage of dogs entering a shelter have no antibody to canine parvo? Well, we find about 30% have never seen parvovirus before they get to that shelter. And this has been true in surveys that we've done in various parts of the country. So it doesn't really matter where it is, it's pretty much the same. What percentage of dogs entering a shelter have never seen distemper? And if they had ever seen these viruses, they would have antibodies and they would be immune. So these are all susceptible dogs. So that range is even higher. Why the difference between distemper and parvo? Does it mean that some of those dogs saw a veterinarian and were vaccinated for parvo but weren't vaccinated for distemper? Probably not. That would never happen, because even for the pet dog, these are core vaccines, and every dog that went to a veterinarian would have been given a distemper parvo adeno vaccine. So what this means is that there's about 20% more animals naturally immunized for parvo than for distemper. And some of you who have had virology will know that the reason for that is parvo is so much more stable in the environment. These dogs would have come in contact with it because it can, for example, we've demonstrated it can remain infectious in clay and sandy soil for at least a year. So it's around and the animals were naturally exposed. Whereas distemper, not as common a disease because it's well controlled in the pet population and it's very labile. It's easily destroyed. So that's a consideration. So these are most important, of course, because they're those that will cause the highest mortality, the most severe morbidity, and importantly, they're vaccine preventable. That's why in pet dogs, where more than 90% of all pet dogs will be vaccinated, we never see or rarely see distemper anymore. So it really is a very well-controlled disease. We have excellent control of parvo, but not as great a control with parvo as we do with distemper, mainly because it's always there and it poses a threat for those unvaccinated animals, whether it's a young puppy that has not yet been vaccinated, a puppy that was vaccinated too early and didn't develop an immune response to the vaccine. So we still see more parvo than we ever do distemper. So the vaccines for distemper and parvo, the ones that are recommended are from the major manufacturers, and I've got those companies listed down below. They're all infectious vaccines. That means they'd be modified live vaccines or recombinant viral vectored vaccines. They have to infect the animal to immunize. They're available often as monovalent, bivalent, or multivalent, and the multivalent are the ones that are most often used. Distemper, parvo, adeno, paraflu, which is called a five-way. And I know if you were counting, that's only four. But the adeno actually provides immunity against two viruses. Adeno 1, which is capable of causing infectious canine hepatitis, a very important and very severe disease that for the most part in the United States, we have eliminated that particular virus through vaccination. But with that said, just about 6 months ago, we were able to get samples from some cases of a disease that occurred in Massachusetts that looked very much like adeno or infectious canine hepatitis. And we did, in fact, find adenovirus. And it's the first cases that we had seen in about 9 years in the United States. So it's still around, it's alive and well, and probably in a wildlife reservoir, because we know that wildlife species of Canada were still being diagnosed with canine adenovirus 1. And Massachusetts, and this part of Massachusetts, they were only about 40 miles from the Canadian border. So usually those foxes don't pay much attention to the borders, and they probably infected some U.S. foxes, but they probably were contributing to the infection that occurred here. And unfortunately, those puppies would never have gotten infected had they been vaccinated, but they were not vaccinated with an adeno vaccine. And so that's the reason that we probably saw them. All of these vaccines are extremely effective. How long does it take for vaccine immunity to develop? Well, specific immunity, it's often said, and you'll hear people say, well, it takes at least 2 weeks for immunity to develop. Well, in fact, with distemper, through the nonspecific innate immunity as well as the specific immunity, we really have some protection within minutes to hours. That's why I mentioned earlier, it's really critical to get those animals vaccinated as early as possible. And for real protection, and this is really as good as it gets, this, with a distemper vaccine, within 2 to 4 days you really have very good immunity that will prevent even mild disease signs. So that's incredible for a vaccine to be able to do that. But ironically, it's not too much different for canine parvo. Within about 3 to 4 days, we can prevent severe disease and death. So usually, and with many other vaccines, it takes longer time. But this, again, is why we want to vaccinate as quickly as possible. Now, a less severe disease within the shelters are the infectious respiratory disease complexes, whether they be canine or feline. And there are a number of other names, and of course the canine is referred to as kennel cough. The feline, we'll talk more about it later, but as upper respiratory or infectious tracheobronchitis and so forth. There is a more mild form of infectious respiratory diseases in both dogs and cats that I often refer to as shelter cough. And it's not nearly as severe, probably some of the same agents, but not all of them causing a severe disease. And as you can see, I consider canine infectious respiratory disease complex, and I'll say the same with regard to feline, not vaccine preventable, but the vaccines really play a major role in reducing the severity of those diseases. So, what really plays a role in causing these infectious respiratory diseases? Well, in the dog, you're looking at many different and multiple infectious agents, viruses, canine parainfluenza, canine adeno 2. It's like alphabet soup, canine distemper, canine influenza virus, canine respiratory coronavirus, canine pneumovirus, which was just discovered in 2011, may be playing a role. Bacteria, Bordetella, streptococcal species, Pasteurella, E. coli, Klebsiella, and others. Mycoplasmas can play a role. But more importantly, there are also non-infectious agents. So if we had a vaccine for every one of those infectious agents, do you think we could really prevent canine infectious respiratory disease complex? Probably not. We would still just reduce the severity of it. So stress. And boy, if I could make an anti-stress vaccine, I would get rich and wouldn't have to be here lecturing today. I could probably be going somewhere to get rid of my infectious respiratory disease complex. Environmental factors like dust, ammonia. Ammonia has a significant effect on ciliary activity of the respiratory tract, and that can make it worse. Humidity, fomites, food dishes, hands transmitting these agents. Poor hygiene, ventilation. Ventilation is a key element in the development of these diseases. The ventilation in those airplanes I've been flying in recently is not real good at doing anything other than circulating the agents round and round the airplane. So that helps to induce problems for humans. But ventilation problems really do play a key role. And I have actually seen instances where a new shelter, either entire shelter or section of shelter, was built, new ventilation put in, and it made a world of difference in reducing the infectious respiratory disease complexes. Power washers. I've never seen a better way to infect animals than to blow all of that material around that contains infectious agents with a power washer. I mean, that's better than my aerosol chambers that I use to infect animals when I'm trying to develop the disease model. So that really works well, not for the benefit of the animal, though. So what vaccines are available for the infectious respiratory disease complex? Well, the Bordetella bronchoseptica vaccines, there's a killed parenteral. That's generally not recommended in a shelter unless you have a really fractious dog and you can't get anywhere near the head of that dog. Because with the other two vaccines, which are most effective, one's an oral vaccine and the other one's an intranasal vaccine. And with those dogs that you can't give the oral or the intranasal to, very likely you'll be able to give the oral. But if you can't give the oral, then give the killed in subcutaneously or intramuscularly, and that's a killed product. And it's not going to provide the same protection, but it'll provide some protection against the Bordetella. The oral is just a new vaccine. It's only been on the market for less than a year, and it does work well, though. It works very well in providing both upper respiratory as well as lower lung protection, whereas the killed just provides lower lung protection and no upper protection. So that's the reason why the intranasal and the oral are recommended over the killed. But sometimes the only place you do want to get is to the back end of that dog and not in the front end of it. I've often said to shelter veterinarians, maybe you should let the dog get kennel cough and it might improve its disposition, but they thought probably wouldn't. It'd get even more angry, and I can agree with that. I don't feel real good right now. The oral, yes. It's live. It's live. Pardon? No. No, it's liquid, and you just squirt it in the mouth, right in the buccal cavity. Yep. It it does induce an IgA response, and one of the reasons is, of course, the central lymphoid tissues for secretory immunity are in the gut. And if you really think about it, when you give that intranasal, of course, some of it's going up into the upper respiratory tract, but where is the majority of that going? It's going into the oral cavity, and it's going into the gut. And so because of Bordetella being such a very effective and refractory organism, it's not destroyed in the gastrointestinal tract, and so it's able to stimulate. It also has a lot of what's known as lipopolysaccharides, which act as adjuvants to stimulate that response. So it really works quite well. Now, the disadvantage of it is you can't put canine paraflu along with it because that's destroyed immediately upon entrance into the GI tract, even the upper tract. So that's why the number one would be a combination of canine parainfluenza and Bordetella given intranasally. The second would be giving the oral Bordetella from a Bordetella standpoint. And the last would be the killed injectable. Yes? There isn't any benefit, but there's no negatives other than in a shelter cost. You would be wasting money. Yep. So no negatives other than uh, the killed is a reactogenic vaccine, so you may have some reaction from it, just because of the nature of that organism. It does cause type 1 hypersensitivities or immediate hypersensitivities at times. That's a really good question, and there are no known contraindications of doing that at this time. But as I say, it has been on the market for just a short period of time, and so we often don't have those questions answered until it's out in the marketplace for a while. Yeah, but right now I can't see how that dewormer would affect the infectivity of it. Could it possibly interfere? It could potentially, but we don't have any information that would say that that's the case. We'll always have to think of those things, though, when we're mixing various vaccines or preventatives, etc. So, with regard to canine influenza virus, we actually do not recommend this particular vaccine in shelters, mainly because it takes too long for immunity to develop. It takes a minimum of 3 weeks. You have to give 2 doses of it. It's a killed vaccine, and you have no protection until 7 days after the second dose. And the shortest period of time that you should have between those doses is 2 weeks. So that's why we've got this 3-week period. So we rarely are using canine influenza virus in shelters. Now, fortunately, even though this is a new virus, and there's a large percentage of the entire population that has no immunity whatsoever to canine influenza, it only came into the species in 2004. We have not seen it occur in very many shelters. There have been some shelters and some kennels that have outbreaks, but it's not a casually transmitted virus. It takes some intimate association with infected and susceptible animals to transmit. But of course, you have that in a shelter environment, and if it does get in, then it will transmit because we have no natural immunity or very little of it. And there haven't been that many animals vaccinated with the product either. So that's something that we always have to consider as well. There are 2 vaccines available. They're both killed vaccines. And as I've already said, it takes 3 weeks. Now, canine respiratory coronavirus, we still don't know whether that actually causes or contributes significantly to canine infectious respiratory disease complex. We're still trying to figure that out, and we don't have it figured out yet. There are some people that say yes, it does. There are other people that can't reproduce those results. Canine pneumovirus, newest kid on the block, came in 2011, and everything I've seen so far and that we've done to look at that, it really is not making any contribution. It's not a considered a concerned player in the whole thing. It looks like it came from rodents and it's infecting dogs, but it's one of those things that I call a good virus. There are good viruses and bad viruses, and it's good because it doesn't cause a significant disease and it helps to stimulate nonspecific immunity. What about cats? 3 most important diseases are ringworm. You talked about that already in detail, so we're not going to talk about that other than I'm going to tell you that we had a ringworm vaccine for cats years ago, but it's no longer available. It's off the market. Feline Panleukopenia, clearly the most important. And feline respiratory disease complex. So what do we have? We've already done the ringworm. Panleukopenia or parvo. That feline parvo is probably the ancestral virus of parvo of the dog, parvo of the mink, parvo of raccoon. So it actually was probably around in ancient times. There are descriptions of cats in Egypt way back when that had a disease that sounded like feline parvo or panleukopenia. So that virus is the oldest of that group of viruses, of which canine parvo probably mutated and became a virus of dogs for the first time in 1978. So it's a really new virus. I know it's probably before you were born, but it's a new virus to me. What percentage of feral cats, for example, have no antibody to feline parvovirus? Well, when we did this study, and others have done studies throughout the U.S., and they come up with about the same thing, about 50% of feral cats have never seen parvo. And that really surprised me, especially in this area where there was opportunities for dogs to have contaminated the environment. There's opportunity for mink. We have wild mink that are in that environment. We also have some other felid species that could have been infected, but they're not contaminating or they're not infecting naturally our feral cat. What percentage? I've already told you what this one is. Again, somewhere around 30%, 50% of cats entering shelters. We've got modified live or infectious vaccines, killed vaccines. They're available in many forms. You can give them parenterally or intranasally. But in shelters, we always recommend that they're parenteral, that they're injected and not given intranasally. Because one of the things we found about 15 years ago, we hadn't seen outbreaks of panleukopenia in shelters for years. And then all of a sudden, they're popping up around the country, and we're wondering what happened. Did the panleukopenia mutate, or aren't the vaccines working? Well, in these shelters where panleukopenia was occurring, we found that they were using the intranasal three-way vaccine, panleukopenia, clecy, herpes. That's not a good way to vaccinate cats for panleukopenia. Injection is much better because the primary cell where that vaccine virus will replicate is a lymphocyte, and they weren't getting to the lymphocytes very easily when given intranasally. So we recommended either don't use that trivalent vaccine with panleukopenia and use an injectable panleukopenia, or if you're going to use the trivalent, then also give an injectable. And when we made that change, the outbreaks went away. So we do need to focus on getting the panleukopenia parenterally injected rather than intranasally. The clecy herpes are great given intranasally because they replicate in the epithelial cells of the upper respiratory tract. No problem whatsoever. It's easy to get to those cells. So that's what that slide says. And that's what that slide says as well. So I won't say that again. I'm always a few slides ahead of myself. Onset of immunity with panleukopenia, I've already mentioned that, and that's the same as with the canine parvovirus because they are so similar, 3 to 4 days. So there are many vaccines that are available to help manage feline infectious respiratory disease complex. The two most important are the clecy and the herpes. So the FCV, feline clecy virus, and the feline herpes virus. So ironically, this virus is so widely spread among cats within an environment. When we looked at feral cats, 90% of them are already infected. And one of the things that I teach all of my students during second year, so some of you who are first year, you will remember this for next year when you're second year. And that is, I always ask the question, what is the difference between herpes virus and love? And the answer is herpes is forever, and love may or may not be. And it's strange, I'll have students from like the first class that graduated 25 years ago, they'll call me and say, I still remember the difference between herpes and love, but I don't know the answer to this question that I'm asking you. So at least they do remember something. So what percentage of shelter cats have antibody to calicium? About the same as to herpes. And believe me, they weren't vaccinated. They were able to spread that around. So the vaccines, again, there are multiple vaccines available to help manage FIRDC, but just like with canine infectious respiratory disease complex, there's all those other things that are playing a key role. With regard to calicium herpes, probably the best vaccines would be the modified live vaccines given parenterally. Now you might ask yourself, why not the intranasals? Well, they are very effective, and that's generally what I would recommend for a pet, excuse me, a pet cat. But sometimes those vaccines actually make the FIRDC somewhat worse in that shelter environment. And that will often be one of the reasons that some shelters will euthanize cats. So it could be really a death sentence if that vaccine makes the disease complex worse. So the parenteral live vaccines then would probably be more often used than the intranasal in shelters where they're having a problem. And there are also killed or non-infectious vaccines for Clece herpes. And I'll tell you a little bit later as we discuss FIRDC that I sometimes recommend those if I find that the modified lives aren't working. So be the intranasal or the parenteral. And sometimes both were given. For example, some not too many years ago, Dane County was using both. So Dr. Newberry and I did a study to see whether there was really any benefit from using both at the same time. And the answer to that question was no, there wasn't an advantage to adding that intranasal and or the parenteral, either way. And so one was discontinued, which then lowered the costs. As I mentioned, in some shelters that were having real severe FRDC, I actually switched them from a live vaccine to a killed vaccine. And in those cases, they sometimes improved or reduced the amount of infectious respiratory disease complex that we were seeing in the cats. And I have an explanation for it, but I don't have time to give it to you. And I don't know if it's correct anyway, so I don't want to tell you something that's not correct. I still have to test it and make sure that that is what's going on. But it really came as a surprise, first of all, when I suggested to the shelter veterinarian to make that change. They thought I was crazy for making the suggestion. But after I talked them into it and things seemed to improve, then I wasn't quite as crazy, but I still couldn't explain why that I wasn't as crazy. Not that there wasn't as much disease. Chlamydophila felis used to be known as chlamydia felis. We have vaccines for them. That can contribute to respiratory disease, but I don't recommend the vaccines because I haven't seen any effectiveness from them. Same thing, there are Bordetella vaccines for cats. Bordetella is part of the flora, contributes, but I haven't seen a benefit from using Bordetella vaccines in shelters that had a real problem with feline infectious respiratory disease complex. There have been some reports that the Bordetella helped, and that's one of the things that you always need to keep in mind. When you're in a shelter environment, you need to really answer some of these questions for yourself within that environment. If you start using that particular vaccine, does it improve and reduce the amount of disease you're seeing. And if so, then for sure use that particular product, because in that environment it seems to be working. But you can only determine that for yourself. And that's where you have to set up these trials to know whether or not there's going to be any benefit. Because cost is always an issue. So if you don't need to give something, you don't want to give it. One, it costs more. Two, it can create some adverse reactions that you really don't want to create. FELV, very quickly, most shelters are testing for both FELV and FIV. That's a combo test. Most often the test used is the one that's available from IDEXX. What it actually detects is the antigen to feline leukemia virus, and it tests the antibody to feline immune deficiency virus. Now, with that said, the reason we're testing, though, is we want to know if that animal is persistently infected. So in the case of FELV, you can't do that by looking for antibody. You have to look for the antigen. In the case of FIV, any animal that is FIV antibody positive is either infected, or what's the other possibility? It could have been vaccinated. But in the shelter environment, we consider that FIV positive animal to be infected rather than vaccinated. Because if they're not vaccinating for Panleuk and Calisi, they're surely not vaccinating for FIV. In fact, very few pet animals are receiving the FIV vaccine. So that's one of the things to keep in mind. So the only source of these two retroviruses, FIV and FELV, really is an infected animal. And those viruses are extremely labile. They die within minutes outside the host. So they don't become environmental contaminants. They don't become a source of infection as a result of a contaminated infection. It's the persistently viremic cat that spreads the FELV, and it's the infected FIV cat that spreads FIV. So then one of the things that we have to look at is elimination or isolation of all FELV persistently viremic cats. And that would really be the greatest and most effective way that we could eliminate FELV from the population. I have learned recently, within the last year, that Switzerland has eliminated FELV from their cat populations. And they did that through a testing procedure, elimination, isolation, and a vaccination program. And so one of the things that we're recommending now in the new feline guidelines is FELV has become a kitten core vaccine. So we would like to see every kitten receive 2 doses of the FELV vaccine. You can't start earlier than 8 weeks. So 8 weeks and 11 weeks, or 8 weeks and 12 weeks. And then if you would never vaccinate those kittens again, that would make a significant difference in that animal being refractory to the development of persistent viremia, because there is a natural age-related resistance that also develops, so that by a year of age, a cat would rarely, when infected, ever develop persistent viremia. So that's why we have suggested this particular vaccine now as a kitten core vaccine. And that's for pet cats. So my recommendation is don't adopt kittens born to FELV positive queens unless you keep them for at least 6 months and know they're FELV negative. And I can assure you, if they're born to persistently viremic queens, there are not going to be very many of them that are negative. There's a good opportunity for transmission in utero, at birth, through the milk, and then by that constant contact during that early period. And almost all of them will become persistently viremic because they're so young. FIV, I don't recommend, nor does anyone else recommend FIV as a vaccine for shelter cats. In fact, we don't even recommend it very often for pet cats. It's a vaccine that requires multiple doses. It does interfere with the diagnostic test. We still can't make a differentiation between an infected and vaccinated unless you know it was vaccinated. But with that said, and there's been some suggestion of actually putting a chip in the animal that's vaccinated that tells you it's vaccinated, that doesn't help anyway, because a vaccinated FIV cat can still become infected with FIV and it could still shed. So why do you want to know that it was vaccinated and put a chip in it? And probably the chip will lead to an injection site sarcoma or a chip in site sarcoma. So you really don't want to go that route. But there's all kinds of suggestions that are being made. So clearly, with both the FELV and the FIV cats, we want them all spayed and neutered if possible. So, summary, what are the vaccination recommendations for the shelter? Well, when possible, vaccinate every animal as soon as possible prior to entry or immediately at entry. We found that 50% of dogs are antibody negative for distemper, parvo. 50% of cats are negative. Consider all dogs and cats, unless you have medical records or antibody testing, to be unvaccinated. And vaccinate regardless of age and health status, which is something that we don't recommend in pet dogs, but this animal is at much greater risk than the average pet dog. Vaccinate dogs with a modified live or recombinant canine core vaccine series. Vaccinate cats with a modified live feline core vaccine. Puppies and kittens present a special problem because that maternally derived antibody can interfere with active immunization. So it's very difficult when you have puppies and kittens in a shelter environment for them not to get infected prior to you getting them immunized, because there's this constant challenge. And I can assure you that that infectious virus is more likely to infect than the vaccine is to immunize. And so that's why they're at a real disadvantage in a contaminated environment like a shelter when you have kittens and puppies that are there and exposed all the time. So the vaccines and vaccination programs that are effective in one shelter may not work effectively in another, especially, again, for the infectious respiratory disease complexes. So you're going to have to work that out, and you can determine what the most effective is. And some of the programs may include all the vaccines recommended, core, or only some of the core. I would strongly urge that all shelters, as a minimum, use distemper and parvo vaccines in dogs and parvo in cats. That would be the minimum. We do have some shelters that don't vaccinate. Fortunately, not very many of them. And there are some that don't use vaccines correctly. And if you want more information about what I just presented, just go to Infectious Disease Management in Animal Shelters, edited by Lila Miller and Kate Hurley. And have you had Kate yet? Has she lectured to you? I think she's a little bit later. She's going to come. And I don't know if Lila's coming this year or not. Yep. So you'll have an opportunity to visit with both of those individuals who have been very active in shelter medicine for a long time. Chapter 5, vaccination chapter, you can look at that. And any questions that you might have. How do I do time-wise? God, I'm never on time. Wonderful. For those of you who have had me, you know I'm never on time. Yes, Question? No, I don't. And the reason for it is that if I worried about that and didn't give the vaccines, I'd probably worry then about the animal getting infected and dying. So you sort of uh, have to balance one against the other. Now, usually the immune suppression is not so great that it will interfere with these vaccines working, even in a heavily parasitized animal or one that has had some nutritional deficiencies. But if the vaccines kill them, for sure they're not going to survive in that shelter because the infectious agents will kill them. So that's why I don't worry. Now, if it was a pet animal, I would worry about those things. That's why I say I do have a schizophrenic personality anyway, but when people hear me give a shelter lecture that have heard my pet animal lectures and vice versa, they're wondering, which Dr. Schultz has showed up today. So, question here. Yeah, good question. And we do have programs, and very similar with regard to the core vaccines. We like to take advantage of having those animals at that time to get the core vaccines into them during those spay-neuter clinics. And in fact, one of the advantages of that type of clinic within a community, and we refer to this as community immunity clinics, we're increasing the number of immune animals within that community. And that's a great way of doing it because many of those animals that go to those clinics never go to see a veterinarian. And so we're also promoting vaccination clinics. But if it can be tied to the spay neuter, that's the ideal time to do it. I know that there are people, including myself, who would rather not do it under that kind of stressful situation where they've undergone that surgical procedure and so forth. But hey, we have to take advantage of that opportunity. We may never see that animal again. Yes, I would to enhance the public health protection. Yeah. And uh, for many years, what we have tried to do, and I think unsuccessfully with rabies, is a lot of shelters used to give a certificate for rabies vaccination to anyone that was adopting a dog, and it would be to a particular clinic. The clinic would actually often give them to, veterinary clinic would often give them to the shelter to try and get them to become clients of that clinic. And that worked real well, and the veterinarians were happy in the community that there was that kind of thing. But even with those certificates, we found a lot of them never took the animal to get the rabies vaccine. So I don't know what else you can do. I mean, that sounds like a good deal, but it just didn't work. So yeah, if we wanted to improve the number of animals that will get a rabies vaccine, that would be one way of doing it. And the way we vaccinate for rabies now, we vaccinate them at 12, 20 weeks of age, and then with one dose, and then we vaccinate a year later, and then every 3 years. If we could just get that one dose in, that's going to provide at least 3 years of immunity right there. And if we could give 2 doses, which I recommended in 1978 when we were making a change from live rabies vaccines to killed, if we gave them 2 doses, 2 to 4, 2 to 6 weeks apart, Yes. You, no, no, don't give it before 12 weeks of age. One of the reasons is they're probably not going to respond anyway. And secondly, it is a fairly potent vaccine, and it can cause some problems. Yeah, so we do not recommend before that age. And besides that, they wouldn't be considered vaccinated anyway. You know, if you have to look at that aspect of it. From a legal standpoint, they're not vaccinated because they were vaccinated too early in age. So, okay, looks like I got all the questions answered. Good, thank you.